This campaign is making a difference. You are listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Susan Dolan, your host, and with me is Cathy Barry-Ipema, Chief Communications Officer for the Joint Commission located in Oak Brook, Illinois. Cathy, welcome to the Clinicians Roundtable.
Thank you. I'm glad to be joining you today.
Tell us about the Joint Commission's Speak Up campaign.
Back in March of 2002, we really believed that we needed to start doing more to get patients involved in their health care. Basically, the role of the Speak Up program is to help prevent healthcare errors. Patients are urged to speak up. Everyone has a role in making healthcare safe. That includes the doctors, healthcare executives, nurses, many healthcare technicians, and professionals. But we also feel that patients also can play a role, and the impetus of the Speak Up program is really to encourage the patients to get involved in their care.
What does the Speak Up program specifically encourage patients to do?
Well, specifically, we believe that patients need to speak up if they have any questions or concerns. If they don't understand something, they need to ask again. It is their body, and they really have a right to know. They need to see themselves as an active participant, not as a bystander, but as a participant and part of that healthcare team. They need to pay attention to the care they're receiving. They've got to make sure that they're getting the right treatments, the right medications. For example, if someone is handing them a pink pill and they're usually taking a blue pill or it looks different, they should be asking, what medication is this? Are they getting it at the right time? If they're in the hospital or they're in a nursing home, etc. They need to get involved. They should not assume anything. They should not assume because that nurse or doctor, somebody's handing them something, that it's always right. It probably is. More times than not it is. But if it doesn't seem right, or the time isn't right, or the pill isn't right, or the medication isn't right, they need to speak up. They need to educate themselves about their diagnosis and about the medical tests they're undergoing and their treatment plan. They really do need to, like I said, not just be a bystander, but really be an active participant. And there's so many ways of getting information now, obviously through your libraries, but the Internet is a wonderful place. I know that often people will start going to the Internet immediately to look for information about their diagnosis, about the treatment that's available. That may not give them all the answers to their questions. It may not always be correct, but it gives them information so when they meet with their doctor or their healthcare professional, it gives them some information so they can ask questions so they can become more involved.
Why do you believe it's so hard for patients to speak up?
Well, I think patients are becoming more and more educated and are speaking up more often. But I think often there's this blind trust that, well, they'll tell me what I need to know and take care of everything. And I think a lot of times that's very true. But I also think that doctors, nurses, healthcare professionals are very busy, very, very busy. And so they may assume sometimes that the patient does know something or is aware of something that they should be as far as their care is concerned. So I think that you should never assume. And if you can't, if you're really ill or feel like I'm not comfortable asking questions, get an advocate. Ask your spouse, ask your close friend, ask a sister or brother, one of your children. Ask somebody maybe to be your advocate. If you're going to meet with the doctor, there's so many questions, and especially when you're ill, it can be a very traumatic time for a patient. That to have somebody there who's listening and able to ask some of the questions that need to be asked is helpful as well.
How have healthcare organizations and professionals used Speak Up materials and information?
Well, what we've done is we've made the Speak Up material very easily accessible for everyone. And what they can do is they can go right up onto our website at www.jointcommission.org and go to Speak Up. All the materials there. We have Speak Up programs on not just our general Speak Up campaign, but we have rolled out many other campaigns. We rolled out one on 4 things you can do to prevent infection, because that's a huge issue, making sure that healthcare professionals wash their hands, and as well as patients need to be washing their hands and making sure that's a way of eliminating a lot of infections. There's a campaign on ways to avoid mistakes in your surgery, making sure that the site where the procedure is going to take place, that it's marked, making sure that they confirm that you are the right patient. So there's a whole campaign on how to avoid mistakes in surgery. We have a campaign on information for living organ donors. What should living organ donors know before they do donate one of their organs or part of their organs or whatever? Help avoid mistakes with your medicines. This is a huge issue. That responsibility of checking on the right medications is, everybody has a responsibility in that. Obviously not just the doctors and the pharmacists and the nurses, but also patients. They've got to double check to make sure they're getting the right. If they go to pick up their prescription, for example, double check to make sure it's the right prescription. And let me go back a step. If when the doctor hands them their prescription, they should make sure they know what that medication is that they're taking, how often they should be taking it, and that it's legible on that prescription sheet. Because if it's not legible to the patient, and there's a good chance it may not be legible to the pharmacist. So they need to be involved. Planning your follow-up care. That's another campaign we rolled up on Speak Up, that when you're leaving the hospital or you're leaving a nursing home or whatever, that you need to make sure that you're asking the right questions about your follow-up care. What medication should I be taking? How long should I be expecting to feel ill? Do I need to have somebody there to help take care of me? Will I be able to take care of myself independently? Is there a special diet? Research studies. More and more people are participating, patients and the public is participating in different types of research studies. So they need to make sure that they understand the research study and what they're getting involved in. There's also know your rights as a patient. As a patient, what do you need to know? You have the right to be informed about the care you receive. You have the right to get information about your care in your language. That's a huge issue. I think health literacy, as far as people not understanding, there's different words that have different connotations and meanings in different languages. So that it really is very important for the patients to have someone who can speak to them.
Cathy, what feedback have you received from healthcare professionals about the Speak Up campaign?
Well, we've done a lot of research. After we rolled out the Speak Up campaign in 2002, we've conducted several evaluations of the program to see are people using it, how they're using it. The program is being very, very well received. What we do is, as I mentioned earlier, we do have all this information up on our website. So it's available there for the public. But also we have the actual artwork for each of the campaigns, the brochures, up on the website. So organizations, physicians, nurses, or healthcare organizations, all different types of healthcare organizations, whether behavioral health, ambulatory, long-term care, a lab, a hospital, they can download the information relevant to their type of organization, the patients they take care of, and they can reprint the brochure. In fact, the back panel of the campaign is blank, so the organization can include their name, more information if they feel more information needs to be provided. And so it's very easily available. But the field is using it. It's a great tool for them. When I say the field, I'm talking about healthcare organizations and healthcare providers. Like I said, they can easily download the information. Also, what organizations are doing, they may not use the brochure, but they may want to pull information from it and use it in their patient handbooks and information that they provide to their patients. So they certainly can do that as well. So the information is really very readily available.
What feedback have you received from patients?
The patients like it. The audience that we specifically deal with are healthcare organizations and providers. Typically, the patients and the general public go through and work with the healthcare organization. Though a lot of patients who are very familiar with who the Joint Commission is, they will come to our site. And the comments that we've received have been very positive, that they've been able to use the material, and it kind of helps guide them in asking questions and really giving them authority, if you will, to ask questions and to feel like they do have some control over their body and over their health care.
Do you have a success story to share?
I think that the success stories that I can talk about are specifically when I hear someone say, the Speak Up program was really helpful to us in asking questions and getting involved. The other thing that I've heard from accredited organizations who've used the program is they have taken it and have totally embraced it. Some organizations have had their nurses and doctors talk about the Speak Up program and what patients should be doing, and have done advertising campaigns and have done interviews with, their local media about the importance of getting involved, of encouraging patients to get involved and to ask questions. Many times I think, quite honestly, patients may feel a little intimidated to ask questions or feel like, I don't want to feel like I'm challenging the healthcare professional. I will tell you, I think good doctors and good nurses and healthcare professionals appreciate patients who are well educated and ask important questions, because if they understand their care, if they understand their treatment, if they get themselves involved, chances are the outcome will be better for that patient as well. And that's what it's really all about. It's making sure that patients get the right care, good care, and get better.
Cathy, thank you so much for joining us to discuss the Joint Commission's Speak Up campaign.
Thank you very much.
I'm Susan Dolan. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions at reachmd.com, which now features on-demand podcasts of the ReachMD library. Thank you for listening.
This ReachMD program is featured on Sermo, a free online community exclusively for physicians. To discuss this program with your colleagues, visit www.sermo.com. That's SERMO.com. When you join, enter ReachMD in the promotion box to receive a $15 Amazon gift card.